I want to talk a little bit about crow's feet treatment with neuromodulators. If you look at all of the neuromodulators, it's interesting. On label for Botox, you are supposed to use about 12 units per side to treat what's called the orbicularis oculi muscles. These are the O-shaped sphincteric muscles that when they close, they bring down our brow and they create the crow's feet. That is a lot of toxin for most patients. If you have a big masculine male with good muscle content, maybe I would use 12 units per side in that patient. But someone like myself that's been getting neuromodulator for the better part of a couple decades, I shockingly probably use about a third of that in my eye area. And so I want to explain why. There's something called a Duchenne smile. Part of our authenticity of a smile comes not only from our mouth, but it actually comes from animation around our eyes. And if we are completely blocking off the orbicularis, it starts to look a little odd when we smile. So sometimes I will have patients come as a new consultation and say, I've had really unsuccessful treatment in the crow's feet region. I got shelved out, I looked scooped out, I looked more tired, and that's because we're over treating this orbicularis area. So I tend to emphasize treatment of the upper area, the upper fibers of the orbicularis. That's what creates some of this tail lift in this region. And then I softly graduate the amount that I use as we head towards the inferior part of the crow's feet. I use very small amounts in order to soften but not completely eliminate. I think that's what looks the most natural and coordinates with the smiling that comes from our mouth. We're preserving some of that muscle movement in this area because that muscle helps with lymphatic drainage and it also helps with soft tissue coverage. If we're taking it out, it tends to cause a show of the orbital rim, which is this bony platform right here, and people can look more tired. Or if their lymphatic drainage is affected by not having effective muscle movement, they can get something called a festoon, where you start to develop a little pocket of fluid in this region. It often is worse when you get up in the morning and improves during the day. These typically are temporary in nature, but I think you want to speak with an injector that has finesse and has experience in how to treat this. So they're not formulaic and doing the same thing on every patient, but they're really looking at your unique architecture in order to deliver results where you see softening of the muscle movement, but you see preservation of the smile.